Welcome to Savithayan's lecture cast in anatomy. We're going to learn about the greater wing and the pterygoid process of the sphenoid bone. The sphenoid bone is an unpaired, irregular pneumatic bone present at the base of skull. As you can see in the picture, it's wedged between the various bones of the base of skull. It is either bat or butterfly in shape. The parts of the sphenoid are body, two lesser wing, two greater wings, and two pterygoid process. This picture clearly shows the various views of the sphenoid and its parts. Moving on to the greater wing of sphenoid. The greater wing of sphenoid has got three surfaces and two borders. The surfaces present in the greater wing are the superior cerebral surface, the lateral surface, and the anterior orbital surface. Moving on to the superior cerebral surface, it forms part of the middle cranial fossa and it lodges the temporal lobe of the cerebrum. The main features seen here are the foramen rotundum, which transmits the maxillary nerve. Behind it, we have the foramen ovate, which transmits the mandibular nerve, axillary meningeal artery, lesser petrosal nerve, and emissary vein. Behind it, we have the foramen spinosum. The foramen spinosum transmit middle meningeal artery and emissary vein and nervus spinosus, or the meningeal branch of the mandibular nerve. Unnamed foramens may also be seen, which are the emissary sphenoidal foramen and canalicus innominatus. The emissary sphenoidal and canalicus innominatus is not usually seen in the sphenoid bone. Moving on to the lateral surface. The lateral surface is marked by the infratemporal crust. The infratemporal crust divides into two parts: an upper temporal part which forms part of the temporal fossa and gives origin to the temporalis muscle, and the lower infratemporal part which forms part of the roof of the infratemporal fossa and it gives origin to the lateral pterygoid muscle. Moving on to the anterior surface, the anterior or orbital surface will form part of the lateral wall of the orbit. It has got two serrated articulating parts. The upper one articulates with the frontal bone and the lateral one articulates with the zygomatic bone. We have two smooth borders, one between the greater wing and the lesser wing forms the superior orbital fissure. The other between the infraorbital fissure is formed between the greater wing and the body of the maxilla. Moving on to the borders, the two borders are, we have the lateral squamosal border which articulates the squamous part of the temporal bone, and we have a posterior border. The posterior border is again in two parts: the medial part which forms part of the foramen lacerum and the lateral part which articulates with the petrous part of the temporal bone. On the normal basalis, it has the sulcus tubae which lodges the cartilaginous part of the auditory tube. In between the lateral, where the lateral and the posterior border meet, we have the spine of the sphenoid. The spine of sphenoid has got attachment to three ligaments and two muscles. The ligaments are the sphenomandibular ligament, anterior ligament of the malleus, and pterygospinous ligament. The two muscles are the tensa velae palatini and the tensa tymphani. Moving on to the pterygoid process. The pterygoid process is a downward extension from the junction of the greater wing and the body of the sphenoid. The features seen in the pterygoid process are it's got two plates, the medial pterygoid and lateral pterygoid plate. The posterior part where the two plates divide, it's called as the pterygoid fossa. The anterior portion of the pterygoid plates unites and it forms part of the posterior wall of the pterygopalatine fossa. In this we can see the anterior opening of the foramen rotundum, and below we can see the pterygoid foramen. Moving on to the medial pterygoid plate. The medial pterygoid plate, the lower end of the medial pterygoid plate, we have the pterygoid hamulus, around which the tensa velae palatini hooks around the pterygoid hamulus. It has got two surfaces, a medial surface which forms a part of the lateral wall of the nose and the lateral surface which forms part of the pterygoid fossa. The posterior free border will give attachment to the superior constrictor of the pharynx and the pharyngo-basilar fascia. Near the upper part of the medial pterygoid plate, we have a boat-shaped fossa called the scaphoid fossa, which gives origin to the muscle tensa velae palatini. Moving on to the lateral pterygoid plate, it's otherwise called as a muscular plate. It has got two surfaces, a medial surface which gives origin to the medial pterygoid muscle and a lateral surface which gives origin to the lateral pterygoid muscle. We have a posterior free border. In the middle of the posterior border, we have a spine for the attachment of the pterygospinous ligament. These are the various features of the pterygoid process. Moving on to the ossification of sphenoid bone, it is a membrano-cartilaginous ossification. It is divided into two parts by your hypophyseal fossa. We have a pre-sphenoid and a post-sphenoid part. The pre-sphenoid ossifies from 6 centers. It is completely cartilaginous ossification. The anterior part of the body and the lesser wing is ossified from the pre-sphenoid. The post-sphenoid is ossified from 8 centers. It is the cartilaginous ossification is through your posterior part of the body, part of the greater wing of sphenoid, the hamulus and lingula. The parts from our membranous ossification or the lateral part of the greater wing and the pterygoid process. At birth, the sphenoid has got 3 parts, the one for the body and the lesser wing and 2 for each side of the greater wing and the pterygoid process. All these 3 parts unites by the end of first year. Thank you.